I remember when I was really little, I fell down the stairs and I tumbled. And when I hit the bottom, my leg really hurt. It was the next day that my mom took me to the doctor, but it was for a totally different reason. She already knew something was wrong with my leg. My first surgery, I was 5 years old. I was crying and they were holding me down. You know, I didn't know what they were doing. I spent 8 hours in recovery, which was the longest that I've ever spent. Imagine having no idea what's going on with you, waking up with this fixator and these pins in your leg, and it was scary. I think it was first grade. I actually drew a picture and wrote a story. And my mom went to the school and she read it. And she's read that I hurt my leg when I fell down the stairs, so she saw that I thought that's why I was going through this, and I was seeing the doctor and I had this leg problem. She came to me and she explained that I had Ollier's disease. When I was 8 years old, that was the time where it was most tiring for me because I had one of the more complicated fixators on my leg, and I had it on my femur. So it hurt a lot more, and I remember I was on a lot of medication and I was very pale and I was very sick and I looked sick. This time I got out of surgery, I was in recovery for an hour and I was in my room. Because now I know what's gonna happen. I know what I'm gonna feel and how I'm gonna feel, and it helps you get through it better. I'm like a pro. I am not on pain medication. Nothing really takes the pain away. It would take the edge off, but I'm not in a pain state where I need anything. When I get the pins off, the first thing I'm planning on doing is swimming and dancing, a lot of stuff. That's the plan.
She was 1.5 years old, and she was in her little diaper with a little t-shirt. And I was playing on the floor with her, and then she got up and she was walking around. And I noticed that one of her knees were bent, but both her feet were flat and her hips were not straight. I kind of went, what is that? And I laid her down and I just laid my hands down her hips and I said, okay, this looks even, and I lifted up her feet, and her one ball of the foot was longer than the other, so I said, I think my daughter's leg is shorter on one side. I wound up calling my insurance and trying to find a doctor, and they said that I wouldn't be able to see a doctor for like 6 months. I said, what? Talking to my nurse friends, one of them came and said, I don't have a phone number, I just have 2 names, that these are the best for children's pediatric orthopedists. And I looked him up, I found him, I called, it was a Thursday, and the woman said to me, I can see you Tuesday. He looked at the x-rays, and within about 2 to 3 minutes, he said, your daughter has what's called multiple inchondromas, and it's a disease named Ollier's disease.
Ollier's disease is enchondromatosis, which means that you have these tumors in bone, which are called enchondromas, made of cartilage and tissue. And that cartilage and bone grows in many different locations within your bone. So enchondromas, these are tumors. Enchondromatosis means that it's all over the place, basically, or usually on one side of the body, and it's called Ollier's disease. It's not a common disease, but it is something that, because of limb deformity, I see quite often.
One doctor actually explained it to me. When you're born, you have all cartilage, you don't have bones. As you're growing, your genes go on. It's like the little switches go on to say, okay, now cartilage turned to bone so I can walk. It's like a faulty switch, he says. The light is flicking. It's not making bone, it's just regenerating more cartilage.
The severity of Ollier's is always different. Not everybody has it the same way. Some people get underneath the skin tumors called angiomas. Sometimes they have it in their hands, which I've seen very commonly, in their upper extremities. And then sometimes they have it in their lower extremities as well.
Hey, it was great. Yeah.
That was your
truth?
This is my mango.
Oh, you're a little bloody, baby.
Yeah.
What happened?
I don't know, I started walking.
And you're a little swollen too.
Yeah, it was yesterday.
All right, let's prop the foot up.
I'm
Let's
really
the leg up.
swollen.
Yeah, let's lift this up.
Yeah, wait. I've had 11 surgeries all together. This is the first time that I've had 2 fixators on my leg.
Many patients with Ollier's disease develop problems with limb length. That side can be very short, or also it can grow very crooked, and that's my specialty, is to straighten crooked legs. We try to treat it mechanically with devices that we can slowly correct the bone and slowly lengthen the bone. You don't do it all at once. You do 4 centimeters here, 5 centimeters there, which is 2 inches here, 2 inches there, another 2 inches a couple of years from now. You know, I've done patients up to 8 inches, you know, it's at times if I go slow enough.
It's called the Lizarov spatial frame, named after the man who invented it. There's about 6 pin locations coordinated with a color and a number. That little dot thing there has a line, and that line has to be aligned to a number on the actual pin. We have a calendar, and it tells us pin 1, which is red. It's on 58 right now. Maybe it has to go to 159 tomorrow. We take every single one and we turn them to put them wherever the doctors told us to put them. These 2 pins down here will keep her ankle in alignment at the base of the bones. These 3 pins here are actually holding her tibia together. The angles that they are in have been determined by a computer that tells them when to turn, how many to turn. It's actually a linear frame. It runs parallel to the body itself. They make a break in her femur, and then they put these pins here to hold this piece of the femur, and then they keep these here to hold this one together. And there's this little keyhole, and you put a key in there, and you make 1 complete turn a day. And the way we know is by putting this nail polish. So we were able to gain from here to here. This is exactly equivalent to the amount of bone we gained inside her femur. Right now, all we're trying to do is avoid infection every day.
By the time I get them out, I have to recover from the surgery. It's not a lot though. They take it out and I can get up and I can, you know, I can't walk yet, but it's easier. It's not harder. By the time summer comes, I should be walking. And then I'm saying swimming because I need to be athletic and I need to get my muscle back in my leg, and I love swimming, so.
Because she was growing so quickly, they put steel plates in on her growth plates on her healthy leg to slow the growth down. Basically, making her maybe overall 2 inches shorter than what God wanted was better than having to make her do this whole process 2 more times.
I was the first one that held her when she was a baby, and she was perfect. When she was like 2 or 3 years old, she used to lean to her right, you know, like something was off. She never stood straight, and we thought that was kind of her way of being cute. And then Olivia started noticing that it was constant. We took her to some type of foot specialist, And basically they didn't know what to do. They were thinking that it was bow-legged, it would correct, that would eventually phase out. For the longest time, we really didn't know what was going on with her, and we didn't know what to do. In a way, I felt a sign of relief that it wasn't malignant and that we could figure out a way to work with this disease. What I wasn't prepared for was how brutal this process was, because we thought this device was going to go, like when you break your arm, you get into a cast. But it was shocking. It was just totally not what I expected. When she was little, she didn't understand. She would basically tell me, "Why are you letting these people hurt me?" Which was very hard to swallow, For someone who's tried to solve problems and always has an answer and thinks logically, it's like someone you love is really being hurt and you can't do anything about it.
Yeah, I don't know, 6 months.
It's not filled in yet, that's for sure.
It's not? Okay.
No. This has been slower than the other parts of her body to fill in.
Right.
It's filling in. I mean, there is bone there, it's just not.
What do you think about the swelling? Do you think it's that too?
Hello. So where's your swelling?
Well,
On the ankle itself?
Yeah.
There's swelling.
it was worse. It
Move
was,
your ankle up and down?
today it went down a little.
So maybe we should go on some antibiotics just because the pins are going away. And then hopefully when I see you in 6 weeks, we'll see more bone there.
Okay.
Okay, what if the bone doesn't fill in well, then we'll have to take some bone marrow from you and inject it in there. Not while you're awake, while you're sleeping.
Really?
It would just be it wouldn't be a procedure, it would be an anesthesia.
My heart kind of sank because I don't really like a sentence that says bone marrow in it. I really don't want to know about any more surgeries other than removing this facial frame.
To heal. I think it's going to be fine. You've healed everything before.
Yeah.
I just think it's a little slower.
Gabriella is nearing the end of her surgical treatment, which has been quite extensive over the last 10 or 12 years of her life. She has straight legs, and the knees and the hips are functioning normally, and the ankle is functioning normally. The bone should not degenerate. She will not get a deformity again, which is for her tremendous because that's been her problem over the years. And I think that she's excited by that.
When I was younger, it bothered me more when someone would look at me or ask me things. I would be more self-conscious than I am now. People are just looking because they're curious.
I think I always worry about how she feels emotionally. I'm just always gonna gauge, okay, how is she? I know she has pain, and that's what I would say to her because she wouldn't cry. And I would say, Gab, you're allowed to cry. You're 14, your leg's broken, you're lengthening it, and it sucks.
I don't tell people how I feel a lot, and I don't express myself a lot in that way. I am who I am because of my disease and because of what I've been through and how much I've learned from that. I understand what it feels like to be very different. I know what it feels like to have a surgery and then come out and then be sick and nauseous. I don't know what kind of person I would be without this. So, Ollier's disease, it's a part of me. I'm gonna live through it and I'm gonna be that person that you see, like, wow, she overcame it. I've never seen my disease in someone else, and I don't even see it in me.
We thought it was like a genetic disease or something that came from, the elements. We were like at a loss. It was a very difficult couple of first years trying to cope with this disease.
Something my husband has always said, isn't there a way to make this stop? Their experience in removal of the tumors and making them, taking them out has been that within 6 months to a year, they'll be exactly where they were originally. So there is no cure.
I think 20 years ago, certainly, both the biology and the technology were not adequate to treat this disease well enough. Today, that's not the case.
My name is Barbara Butler. I grew up in West Deptford, New Jersey. I wasn't diagnosed through my childhood with Ollier's. It was very difficult. So they never really knew what was going on. I didn't get a diagnosis of Ollier's disease until 1981 when I was 27 years old. I was about a year old when I started walking. Bones in my legs started growing at odd angles. My parents took me to a surgeon who said, wait till she's fully grown and then we'll do something. They didn't like that opinion, so they took me to another doctor who says, oh no, if you'd done that, she'd have been crippled for life. My first surgery was in 1956 and I was 2. They broke my legs, reset them, and put me in body casts. So every 2 years as I grew, they did that again. So it was either a body cast from the underarms down, or it was like a one leg half, one leg long.
How long would you wear the body cast?
6 weeks to 3 months. Although I was pretty quick to heal, and I was up usually faster than the doctor thought I would be. They were always amazed at how quickly I got up.
In the 1930s, the procedures used to correct limb deformity caused by Ollier's were even more crude than in the 1950s, but very successful regardless. Stanley Wadham is 81 years old, and the technique used to correct his limb deformity is remarkable.
They put the right leg in a sling with weights on the end, and just, I think he had to cut a bone in the side. About 1934, I was 7 years old when my parents noticed I was walking rather strangely. No pain at all. We went to the doctor sent us up to the orthopaedic surgeon at Norwich Hospital, and he said it was Ollier's disease. So he didn't know anything much about Ollier's. I was in the hospital for 18 months. I went in when I was about 7.5. Came when I was about 9. They did stretch it so it was more or less the same, but then after a few months or years, the left one grew, the right one didn't.
So I think there's two issues here. One is the engineering technology that we've been able to take care of recently. In terms of getting bone to heal, we've even moved ahead in biology. If a limb was predicted to be shortened more than 10 centimeters 20 years ago, they would have said you should just have an amputation, or they would just break the bone and lengthen it, which would cause multiple complications. Basically, what they would do is they would cut the bone, lengthen it acutely in the operating room right there, and then put a plate on the bone. And that was really what was being done, but there'd be a lot of complications, from high blood pressure to failure of the bone to infection to non-healing bone, and the complication rate was exceedingly high.
About 16, they said I had fully grown and that they didn't think anything else needed to be done. So it stopped, and we assumed that was the end of everything. There really was no issue as far as mobility. Like any other person, I could do anything. I danced, I ice skated, I roller skated, rode a bike. I went to nursing school and then became a nurse and worked hard, and I had a normal life like anyone else.
After 3 or 4 operations, they're more or less level. I then started to go to school again, you see. Always tried to keep up with the other boys, tried to do what they did.
We have been married for 59 years. You were quite fortunate in being chosen, because you couldn't go in the services, to go for training. Okay, you didn't like it to begin with, but you trained as your profession, and you've had a very successful business, haven't you?
No, I was never felt any different, really. I want to be as normal as possible.
I've had these pins in for 8 months, and we're still counting days. I had the upper pins removed, and I love having them out. It was actually really interesting to feel the difference. I feel a lot lighter. I feel like I can do a lot more than I could when I did have them in my leg. There's scar tissue, so it does hurt sometimes. It's a little sore, but it doesn't kill me, so. There's a point where you stop turning the pins and then you wait for your bone to heal, and this is a chapter that I'm in. When I go to see Dr. Feldman, I hope to find out when my bottom pins are going to come out. That's what I'm really looking forward to.
Gabriella suffers from headaches since I can remember, always. She would have these small periods of double vision. But I did see an ophthalmologist specialist, and he was concerned that there was maybe something pressing against one of the main muscles that hold your eye. When he said something's pressing against it, it's like all the red flags went up and I got nervous. But we went and got an MRI and he didn't see anything.
They call that sinus disease. I guess it's more severe. It makes me very frustrated because when my head hurts, my eyes hurt, and it's hard to read, and I feel like something's failing me. It's not related to my Olliers. I know from talking to my doctor, I will always have Ollier's disease. Always. Always be in my body. I know that it can turn into something worse. It does cross my mind that I could have, maybe I will, when I get older, have cancer. Maybe I will have to go back to another surgery. I'm acknowledging the possibility, but that doesn't determine how I should live my life now. That's why many people say live in the moment, because you should. That's the truth. You can feel so alone sometimes, but it's so rare because I have my family, and that's all I need.
The older sisters always made sure they would care for Gabriella's welfare and her comfort whenever they were together. As siblings, they were inseparable, especially Leonardo and Gabriella.
I'm really close to her. She's close to me. We hang out most of the time. We have fun. When she can't do the things that makes her happy, that makes me feel very upset. Sometimes I wish that it was me instead of her.
You know, all the struggles in life that you're supposed to face later on, she took it on now. She grows up so fast. She can't relate to a lot of young girls because the girls are talking about boys and I got a new cell phone or something, and she's talking about Ollier's disease. No one can relate to that.
One of the things that Gabby has taught me is that you will only fail if you choose to fail. Gabby's made me realize a lot more things about the world and the people that live in it.
You see, you again lost me on Friday.
I texted you. What happened that day? Something happened. Something with my doctor.
Your tutor.
Today, your busiest day?
I've been treating Gabriella since 2004, I believe, 8 years. She was 6 years old. I remember in the beginning she used to kick me, she used to punch me, She gave me a little bruise on my face one time. Yeah. So I understand when the fixators are on, she's in a lot of pain. And here I'm hurting her. It's not only that you are going to achieve the range of motion, but then you have to deal with a lot of muscle weakness and atrophy. I mean, you have to do something within a tolerance, pain tolerance, so that the patient will be cooperative. There's a lot of emotional things going on, where she's, will I ever be out of this pain? Will I be able to walk again? I have to give her a lot of assurance that, okay, we achieved this much range of motion, we achieved this much strength, so we are progressing, slowly. There are some days when we go 2 steps up and then all of a sudden we see that we are down 4 steps because of the pain, because of a lot of other factors.
Sitting here this morning, I'm officially Gabby's driver. She's been in lots of pain the past couple of weeks. As the bone has healed, it wants that fixator out. What I see is that it's an unreachable pain that really can't be dealt with anything, with medication or massaging or anything. She just sits there and basically takes it.
Oh, you're making bone.
We are?
Yeah.
Oh, that's good.
Yes, you're making bone. You don't need any injection. You're making bone. All
Good
right.
news, so
It's
we
not
don't
healed
need-
yet. No, you don't need an injection. You don't need surgery. I know you want it. I think we're close, sweetie. I don't think we're that far away. We'll see you in 6 weeks, and then hopefully by then we'll actually be able to say that maybe a month from then we can take it off. That's our goal. So we're looking at another, I would say, 10 weeks.
Great.
Okay.
This one just took a little longer. The bone is about 85% healed. You have to remember she's gained about 4 inches of new bone overall since last July. What are we in May? That's a lot of time.
It says spinal and feet. So it says the spinal front. It's shingly dark outside and it's in our atmosphere. Oh, thank you. Okay.
We removed the front pin because it was infected. So it gave us a new antibiotic and we were able to see a change already in that. We're almost done, we're almost there. We see the end. It's harder for her now because she's just not sleeping. I would wake up at 2 a.m. and I could hear her softly crying and I knew she was in pain and she would take the hair dryer and blow hot air under her blanket on her leg.
One moment, I was holding my leg and I was experiencing pain. It's just so much frustration, and then you say, this is what I have to take with me. This is what I have to remember. That's what's unique about everybody, is that they carry that with them. They carry experience. Nobody truly understands what something is unless you've experienced it, unless you've gone through it and you've lived it. That's everybody's power. It's just experiencing and learning and listening to your life, like paying attention to your life, to paying attention to what you've been through. It makes me accept things. Accept the things I cannot change. Have the power to change the things I can, and have the wisdom to know the difference.
And one time I started collecting carousel horses. So I got this, it has, 24 different animals on it. I just started collecting different things, and got to the point where I said I gotta stop. I gotta stick to one thing and one thing only, which is I Love Lucy. Said I watched I Love Lucy as a child. It got me through a lot, and I still watch it today. I could watch it every single day. She makes me laugh. I was having thigh pain, but I was driving a lot, so I thought it was from driving, pedal on the gas.
When I was about 35 or 40, the knee started paining me quite a bit. But there again, I used to live with it. But then I'd take a few aspirins and the pain would go away. By the time I got to 80 to 78, the pain was pretty bad.
friend recommended him to go and see Professor Briggs, the orthopaedic hospital in Stanmore, and we went up there within a month, and Professor Briggs just said, "I'm sorry, your leg has got to come off," because it was cancer of the bone.
I went to have x-rays and didn't really expect to find anything, and the orthopedist called me and said, "I think you have cancer." And from there he suggested I have biopsies done. Had the biopsies done, and it was low-grade chondrosarcoma.
The negative of Ollier's disease is what's called chondrosarcoma, and that is a tumor of the enchondroma. And if that happens, then the tumor surgeons will need to do something. And the signs of that are, significantly increasing pain as she got older.
I'm Anne-Marie Malarkey and I'm from Deptford in London, England. My youngest memory of having Ollier's was being about 3 or 4 years old. I just had a straightening operation on my leg. My family were actually given the decision whether to amputate or to have lots of scars. So I said lots of scars, and that was it. I've led a normal life with Ollier's. I was just told to play with other kids, get rough, I had surgery in December last year for malignant transformation of my Ollier's. There's a big difference between Ollier's pain and pain when the tumours transform. With Ollier's pain, there's different types of pain you get all through surgeries. You just know when something changes. Mine, when it changed, was like a burning sensation. It took up the whole knee, but I knew it was in one particular point that hurt the most. We've always known that would be a risk, because that was explained when I was diagnosed. But unfortunately the symptoms weren't picked up at the right time, so it spread and I had to have a lot of my bone replaced.
From the biopsies, I was then recommended to a doctor in New York at Memorial Sloan Kettering, and he determined that I had it in both legs. The first surgery was in my right leg. I had an allograft resection, which is a bone graft from a cadaver. Takes out the tumor, puts the bone graft in. And then 2 years later, they did the same in the left leg. That one, unfortunately, didn't last very long. It broke.
Because of the Ollier's, I had a lot of bulk on my knee and it wouldn't bend. So I had to have a proximal tibial and femoral replacement. The whole of my knees were being removed and there's now titanium in there. And I've had the femoral replaced about up to here and then joining onto the new knee. And then the tibial replaced about down to here. Both ends of the new replacements join onto the knee replacement. So basically it is mostly metal now. Up to last year I was pulling my hair out with the pain of it. It's just getting used to different sensations now and having things in different places.
Can you move your leg on its own?
Yep, like that, but I still can't kick out. I'm still working on that. I went in for some intensive physio and they want me to eventually go from 2 crutches to 2 sticks to nothing.
If I need to use my hands when I'm walking, I just kind of throw the crutches from my hips. But I have to make sure that I feel stable before I take a step. Or with one, I can carry a pot or a cup of coffee and not have any problems, because physical therapists are always yelling at me. It's been an issue since 1981. It's just progressively more debilitating. After all the surgeries I've had, I have really no bone left in my legs. I have femur replacements, knee replacements, rods, plates, and screws. Little by little, they had to remove more of the bone because it was becoming brittle, and there was nothing salvageable.
It is something we all worry about, and I'm sure that Gabriella's parents will worry about and she'll worry about forever. It's usually not within the next 10 years of her life, but it can happen and she has to be followed, not with x-rays, but just clinically and just see how she does. I think that that's much more significant with Maffucci syndrome, which Gabriella does not have. Maffucci syndrome is a different disease. It's enchondromatosis with skin lesions, with angiomas under the skin. And the problem with Maffucci's is that it's a more aggressive form of disease, and it can have much more malignant potential. You don't progress to Maffucci syndrome. You either have Maffucci syndrome or you don't have it. Usually you see Maffucci's early on in the patient. You may only see 1 or 2 angiomas, but you see them. And then by definition, if they have multiple enchondromas and they have angiomas, they have Maffucci syndrome.
My name is Luke Moorcott and I'm from Reading, United Kingdom. When I was 4 years old, Mother noticed me walking around with a slight limp, so she took me to our local doctor, gave me an incorrect diagnosis to begin with until we had a second opinion with Ollier's disease. I've had 5 major surgeries on my leg. And the whole spatial frame was held together by pins like so. Everything went all the way through to the other side of the bone. These were the nasty ones. These little ones went all the way through the leg. This one went right through the shin, all the way down actually. Hated this guy because it went through the heel, which was extremely uncomfortable. I was 17 years old when I had my last surgery. The leg hasn't got shorter, hasn't bowed, the plate hasn't deteriorated. It was a complete success. It's probably set me for life. I have to have yearly body scans to check for any Maffucci's related tumours in my organs, anywhere on my body, to determine whether there is any threats. In 2009 I had hemangiomas removed from my right wrist and one of my right fingers. They were benign, but they were extremely painful.
Maffucci's unfortunately can have high-grade sarcomas associated with them, I think usually angiosarcomas. Enchondromatosis kind of associated with chondrosarcomas. Both patients had to be followed for what's called sarcomatous change or malignant potential in their disease.
And is this something they have to look for their entire life?
Pretty much.
I had one alarm in 2010 that they thought there was something in my lung. It turned out just to be a blip on the radar. Further tests proved there was nothing there.
It takes us quite a long time to get out of the shower and things now, doesn't it?
Yes.
Not like you were. Used to play cricket with the boys.
I've had a very good life, haven't I, Molly?
Yes, we've worked very hard, but we've had quite a good life.
You see, when you have a family, like there were 6 of us in family, I would never treat any different than the others. It's just to get on with life, and there you are. What more can you say about it? I mean, either they're going to sit and be bloody miserable, they might as well not bother.
Emotionally, I'm not going to lie, it has, given me a big scare and put things in perspective. Because it was picked up so late, there was a lot of complications. So I feel quite resentful of that, whereas if it was picked up at the beginning, a lot of the surgeries that I had done I wouldn't have had to have done. I think it's opened me up to a lot more things. Knowing that you have to try that little bit harder in life, I think it makes you stronger. I know that sounds really cliche, but I think it makes you have more of a drive.
I'm content with my life. I can't do a lot of what I used to do, but I find other things that make me happy, like my pets and my house and my friends, and there are limitations, but I find that if you can't do something the way you used to do it, then you have to sit down and analyze the situation and come up with another way of doing things, and that's pretty much how I run my life. Socially, you're different. I mean, some people will accept you the way you are and admire you and think you're doing great, and there's others that'll make fun of you or look at you and just I don't want to be bothered with that person, and you do the best you can. I don't let it define who I am, though. I don't like to be judged that way. Judge me for my interests, my personality, other things, but not my physical problems.
The fixator coming off, is a huge relief. It's like gaining back normalcy. Not fully, because my leg can't bend all the way, but it's a normal state with walking around, being part of my day. Emron, my physical therapist, he needs to break through the scar tissue because it's holding my leg from bending all the way.
Aggressive treatment starts after the fixator is out and the pins are out. The bone healed. Now you can work on the muscles. Once the muscles are strong, your bone is strong too. She will have a little bit weakness. That is one of my goals also, is like make the strength equal to the good leg.
It's like my leg is this log. It's weak, it's not strong. But I've gotten to a place where I don't feel pain. If I have a little ache, it's not enough to restrain me from doing normal, everyday things.
3-4 months is the time frame where she is able to perform a lot of activities, including swimming.
Gabriella, as you know, is an outstanding patient. She has had many fixators and many devices on her for lengthening and straightening. And I'm sure this has taken effect on her childhood and her adolescence. But she is not allowed at least to show, outwardly, because she's just focused on a goal of having a normal leg that she can walk on. And because of that, she now has legs that are the same length and legs that are straight. She has an amazing result. And I think that really is a testament to her fortitude.
I feel good, I feel healthy. I don't need to think about my hospitals, my legs so much. Being sick, I don't have to think about not participating. Physically, mentally, emotionally, I feel so much better.
At the age of about 3, they did this little evaluation, and her leg was growing in such a way that it would have been a U, like a foot would have wound up facing the sky, because her growth plate was forming so awkwardly. So she wouldn't have had a leg to speak of. She would have been very malformed. And when I see her now, I think about that and I just think, wow, it was worth it, because she is as normal can be.
We have been very thankful that we found the right team and we found the right support to help us help our daughter get through that and come out on the other side. It's a life-changing event. I mean, they've changed her life. I have a bond with all my kids, but it's different with Gabby. Not that it's tighter or better, it's just a different thing, because it was a relationship that wasn't always based on games and fun as the other kids. It was also a relationship that was built on struggle. I'm very happy to see her free, doing what she wants.
My family definitely gets affected. My parents, I know that them, out of everybody, it affects most. I think they are a million times relieved that this is now where I am. Now we all go somewhere together and we're all doing something together.
One thing I've learned, and that I think I want to just make sure people know, is that you have to really research and challenge and find the right doctor, because it may not be the best technique. Because the first surgery at 5 years old, when my daughter was laying there, I questioned. I said, what am I doing?
I think that the most important thing about enchondromatosis, if you're going to be treated for limb deformity and limb length, is that the person doing this for you should really have goals in mind that they tell you about, and you go about them logically. I won't do surgery on the hand of a child with enchondromatosis because a hand surgeon should do that who has experience with that, not me.
I'm Todd Peterson. This is my wife, Eileen Peterson. And our little girl's name is Audrina. We're from Batavia, New York. When we brought Audrina home from the hospital, I think it was 4 days old, when we noticed she had a crooked right finger. When she was 7 or 8 months old, her pediatrician said, well, go ahead and get it looked at by hand surgeon. And the hand surgeon said, oh, she's fine. Kids adapt, kids find a way. And I think it was in that office where there was a really, really astute nurse, and she said, well, just doc, look at her legs. Her legs look a little bit longer. He goes, kids will find a way. And he was unconcerned. And the nurse actually came in afterwards and gave us a number for a physician. He's a geneticist. And he looked at us, and he looked at Audrina, and he was kind of looking for some sort of genetic cue. From his end, nothing really checked out genetically. But he said, I have a great physician for you. I think this is probably more orthopedic than anything. He asked us to get films of her hands. Once we did that, he knew right away.
I do remember waiting in the doctor's room while my husband was with Audrina getting her x-rays. I overheard the doctor saying, you know, I'm going to prepare the parents and talk about the rate of cancer, and I just remember this feeling of I was sick. When my husband came back in, I remember shaking my head like, it's bad, it's really bad.
Well, that was the first time that we'd known what it was.
Right.
It's Ollier's, and I remember trying to pull out my phone and looking it up, and I spelled it wrong, so nothing came up. Dr. Sanders sat us down. He said, I've seen it before. I have patients with this diagnosis. This could progress in any number of ways. We don't know anything until she grows. Just live your life, enjoy your daughter, and as things come up that need to be addressed, then he said that he would help us address them.
We still had to go through ruling out Mafucci's.
That's
so
right.
there were CTs.
He, at that time, scheduled us for a full-body MRI, which she had to go under for, so we were a little nervous about that. But he was looking for soft tissue lesions and hemangiomas. So he said if she shows up with hemangiomas, then she'll have Mafucci's, and the outcome becomes much worse. We got the results probably a week later, and the first good news was there was no soft tissue lesions, no hemangiomas. So we thought, okay, it's Ollier's. Now we have a firm diagnosis, and we just go from there. When Dr. Sanders diagnosed her, she was a baby. She hadn't taken any steps. In fact, she was a very slow developer when it comes to those milestones, walking, standing, crawling. She didn't walk until 2 years old. She's only been walking for 1 year. He said we could use a lift or not. It's up to us. See how she does without it. He thought it would be a little heavy for her to lug around, and it has been, but
she's adapted well.
The lift has at least given her a chance to be a little more symmetrical in the pelvic area.
Audrina is aware that her leg bothers her. You know, she's aware of her bigger shoe. She really appreciates her hands more than any part of her body. She has a favorite finger.
Wait, her bumps.
Her bumps on her fingers.
Which one?
What about the other hand? What's your favorite there? That one.
She does have limitations. She's very independent. She wants to do things, but she also knows when her knee or her hip has had enough. She's a beautiful girl. She is healthy otherwise.
She loves her family.
She's our gift.
She's like a little porcelain doll. People say that to her all the time. Getting the diagnosis was a life-changing event for us, and
absolutely.
We don't want it to be changing for the worse. So we feel like we owe it to Audrina to give her the best that we can as parents. I do think that being that she's so young, that technology is her friend.
I hope too that some of the treatments are going to be a little bit more proactive. It just seems like we wait. Now this has happened, so let's do this. And it just seems like this might respond well to stem cells. You know, give it a try so that it's not so wait and see.
The lengthening and the change of the bone structure is really just a side effect of what the disease is. But the disease is really tumors that can continue to develop and grow in your body. Even though the side effects can be fixed with these procedures that these amazing doctors do, you still have that other factor. You know, how does it affect me later?
When we were in Philadelphia last time, I actually ran into a stem cell research physician. He said, we know the gene. The question is, can we manipulate it to reverse its course and lay down bone? So it seems like such a simple problem thinking about it. Well, let's just tweak that gene and make it lay down bony tissue instead of cartilage. I feel like because the population with Ollier's is so small, there's no money in it. So even if they had a cure, who's going to profit off of it?
Are you daddy's girl or mommy's girl?
Mommy's girl.
I think we need, as physicians, and as even in NYU, I'm doing it for other diseases, I think we need to get out there and talk about people. Maybe Gabriella could be a spokesman for it and say, you need to come to a center that does it a lot. You need to use people who've had experience with this before. I think that they need to be spokespeople for people to go to main centers.
It's scary, it's hard, it's painful, it's not something you want to do. But how am I going to get better? And I did it one step at a time. I didn't think about where I was going to be in 5 years. I thought about what I needed to do to get one step better.
Find the best surgeon, even if you have to travel, because sometimes you really need the best, and local doctors aren't aware of the disease. I don't think the parents need to be afraid. Technology today is so much better than it was in the 50s or even in the 60s. I wish they had those things when I was younger.
Don't be scared of it. It is manageable. You do have to go through pain and surgery, but it is worth it. Once you get to 18, you've got your legs the same length, you're done. And have it all while you're young as well. Don't hold back from any of them because I'm too scared, or which is understandable, but never ever hold back from any of them, just do it.
Persevere. I'm not gonna lie, it can be very painful. It's a long process and it can get you down, but it's all for the best.
Treatment days far advanced. Pity it was about when I was young. The method that I had was a matter of pulleys and weights on the end of your leg. It was pretty uncomfortable.
Just us two.
Don't feel sorry for yourself, that's from the start, because you'd never get anywhere. You must be determined, and you must be not afraid, be positive.
It's funny to think of where we were a year ago. I'm not ignorant to the fact that it could be not the end of what Ollier's needs to bring to her life, but I'm not focusing on it. I'm choosing to focus on her living right now. It's almost like she had this time in a cocoon, and then she's come out of the cocoon as this butterfly.
I'm definitely going to be on top of watching and being aware. Especially when my parents are not here. I'm going to figure out what I need to look out for. Do I need to go get checked? It's just something I will be responsible for. Ollier is just part of my life. It's just so hard to put into words because I'm not defined by it, but it is part of me. It's brought me to this place. I guess it's empowered me in a way. It's given me strength. It's given me a place to find strength.